What's the latest there?
Well, a very good morning. Sadly, as the Health Minister, Dr. Zweli Mkhize, reiterated yesterday that the numbers are not going to get down. We're not going to wake up to numbers having decreased, but we need mechanisms to deal with the increasing numbers. Of course, mentioning that the rate in which the numbers in the Eastern Cape are increasing is a concern to the province and the national government, saying that they will be assisting and giving support to the province. Of course, he said this on his first day of the two-day visit to the province as the numbers keep increasing. He did say, however, he was happy with the plans put in place to make sure that there's extension of hospitals, there's stadiums that are being prepared for the peak period, which the province is expecting in the next 3 months. The beds, the ICU beds and the critical beds that are being put in place, put up to make sure that they deal with the COVID-19 pandemic, especially when it comes to the peak. Well, today is the second day of the minister's visit, and he will be coming here in East London to also talk to the Premier and the MEC about the plans that are put in place, but also to launch the bikes that they're saying that they will help in trying to make sure that they accelerate service delivery and they are quickest in terms of reaching the rural province of the Eastern Cape, understanding the geographic of the province, that we're dealing with a province that has a backlog and a bad infrastructure, especially when it comes to roads. And these are the bikes that are going to be launched, that we are told that they are going to help in terms of making sure that health workers, health practitioners are able to reach those in need in the far-flung areas of the province as we prepare for the peak period. The projections, the latest projections by the province is that in the next 3 months we're expecting about 1,200 deaths, and not the 6,000 deaths that would have been there if the lockdown regulations were not implemented and that the plans in place were not put. But let's talk to the Health HOD, Dr. Thobile Mbengashe. Doc, thank you again for your time. We're preparing for peak period now. Talk to us about the plans and the beds that you've put in place to make sure that you prepare for the worst to happen.
What we are really thinking is that for us to prepare for July, August, September, and October, these are going to be surge and the biggest numbers that we expect. What is important is that the numbers that we expect can still be controlled and can still be managed. But what is really important in the way how we deal with this is that we're planning to have what is called field hospital. 8,000 field hospitals to actually cover the number of people that are not that sick, but they need to be isolated. And we're building another 2,000 repurposed re-engineered beds. These beds are the ones that are going to manage the very sick people. What's important about these beds is that they are being extracted from the current hospital, but they're re-engineered in order to deal and be COVID positive. The re-engineering of this bed makes sure that the flow of the patient is separated from the ordinary patient. The engineering inside the place is actually making sure is able to control the infection. And the use of those services are actually dependent on the proper PPE. So we think that services together with the oxygen support is going to help us a lot, because most people with COVID, they really have a problem in breathing and they need a lot of oxygen. And the next level is really what is called the quarantine sites. We've got a huge number of quarantine sites which we work with Public Works. The aspect of a quarantine site is people with contacts must now be taken away in order not to make sure that they are infecting other people. And these quarantine sites are actually quite a huge number, and we're working with the private sector and we're building our own system. We are also focusing on the targeted testing, isolation, and quarantine. The idea is that we look at clusters. If there is a cluster of new infections that have grown up in terms of the daily numbers, we send what is called fixed teams with managers, with doctors, epidemiologists. They stay within that communities. They follow each one of the person who has been in close contact to make sure that individual is taken out and the infection is actually broken in that communities. That we think is a very important part. But the other part, of course, is to build the human resource. We've gone up and looked for another 1,000, nurses that are actually going to be providing us with extended services. We're looking for more general workers. We're looking for porters. We're looking for other individual cleaners and everyone. We think that's going to be important. What has been important in the province is really the fear and the anxieties from our team. What we're really doing is that we're making sure that our nurses should be ready with the PPE so that the surge, when it comes, they must feel more confident, and we need to support them. We give them psychological support and make sure that there's adequate PPE for them. We are actually strengthening that by building what is called occupation and health safety teams. These teams have got laborers, unit managers, administrators, and the CEOs. They sit and assess the risk within their own hospitals. They understand how many COVID patients are. They tend to understand what is the requirements. If there's a need for more PPE, they must tell us on time. If there's a need for other support, they must tell us on time. And the CEO chairs that, and he has a daily kind of a report onto that. We think that's going to be important, but we've gone a little bit further. National has given what is called an SV, a system that really looks at the stock visibility on a daily basis in real time. And that stock visibility is loaded up on a daily basis. We've included now the PPE items on the stock visibility so that the stock in each facilities we know on a daily basis. And then we added what is called an audit system, because we understood that it's not sufficient to say, I'm told the stock is available. Someone must go and look. So we've got some post-basic pharmacists, about 20 of these. These basic pharmacists, they move from facilities. And if the stock visibility system tells us there are fewer drugs or PPEs, then we go into those spaces. Yeah.
And I'm sure critical to all this, bringing in the health workers, expanding your capacity in terms of beds and these filled hospitals would be to deal with hotspot areas. How are you planning to deal with hotspot areas, especially with the easing of the lockdown regulations and as the country opens up the economy?
Our strategy is really made out of three parts. We know now there are places where the levels of infection is still very low. These are called low transmission areas. They have episodic spiking, and we actually deal with those little fires. Then we've got where there's an ongoing outbreaks. Now we've got four big hotspots: BCM, and that's the East London area, Nelson Mandela area, and Krisani and OR Tambo. The strategy from the ministry is that we must use what is called a targeted intervention within the clusters. We set up teams. These teams are permanent teams. They actually have a leadership of clinical people, epidemiologists, and nurses and other people. They set and they find the index cases. This is a person who's got an infection. They follow the close contacts and go into the communities until the numbers are going down. And they work with the JOC in order to make these other policy interventions of restricting people, making sure there are no funerals, making there's no big gatherings, and people are wearing the mask and they're washing their hands and they're keeping the social distance. I think we think that is a post-lockdown strategy. It's going to make sure that we do three things all the time. People should not stay in crowds. Crowds are very dangerous because this is really where you get a super infection event. Secondly, people shouldn't be staying close to other people because that close in people, if there's one person who transmits a lot, that can make a big infection. The third issue is the closed spaces. Those three things, crowd, close contact and closed spaces, they are the ones that drives these outbreaks, and they are the ones that drives these hotspots, and we really are making sure that these are now managed by JOC, at the same time made to separate the individual infections through tracing, testing, and isolation.
And speaking of that people, it's important that they don't stay in crowded areas because these are a potential hotspot. The biggest challenge you have, Doc, is that in some communities, they don't associate COVID-19 or coronavirus with those communities. To them, it's something that happens far away from them. It's not something that affects them. And the minister said something very important, that traditional leaders and chiefs will need to be at the forefront of educating people, especially moving to the next 3 months. Is there a plan in place to make sure that they are brought abroad and that they really understand that the virus cuts across all communities?
Yeah, this is absolutely very important. Now, the biggest need for us is the social change and the cultural change and really getting a bottom up. We have activated the Masipatisane, going right up to the ward, bringing the councillors, bringing the traditional leaders and everybody else. The communities are going to work now in terms of protecting themselves. The communities are going to be much more aware of what's going on in their areas. They must provide support to people who are actually infected and work against stigmas of individuals and really manage the issues around bereavement and funerals, because it's really a community thing. And we're very pleased that the chiefs have really taken the responsibilities. They are looking after their communities. They are working with councillors, and our teams are actually subjected to the leadership of those traditional people. I think this is going to be the one thing that's going to make a difference in the epidemic. And we think that the Premier has been a big driver, the traditional leaders have been a big driver, and all the houses have really supported this. We think that's going to be what is Masipatisane, and that Masipatisane, it means working together, changing our social behavior, accepting the reality that exists, and working through some of those difficult things that we face as a society.
Doc, thank you so much for your time once again. Dr. Thobile Mbengashe, the health HOD in the province. Well, Blaine, indeed, as the minister said yesterday, the clouds are gathering and we need to move with speed. And if the plans that the HOD has just announced are anything to go by, they are really moving closer and moving with speed to make sure that they bring everyone on board to make sure that the fight against coronavirus is one that is fought by individuals, staff, health practitioners, everyone in the society, traditional leaders, all fighting the invisible enemy, which is coronavirus. And as the president said, Blaine, it is in your hands. So each individual has got a responsibility to make sure that they stay safe, wear your mask, sanitize, wash your hands regularly, and avoid crowded areas, and keep a safe distance amongst other people, so that as we prepare for the peak, which the Eastern Cape anticipates that it will be in the next 3 months, so July, August, and September, we try and minimize the numbers and make sure that we really flatten the curve and avoid deaths and more cases, especially new cases. For now, Blaine, it's back to you. We are still here and waiting for the minister, who is going to be speaking to the MEC and the Premier of the province about the plans in place and how best to deal with the pandemic, especially in a rural province like the Eastern Cape, where the rate in which the numbers are increasing is a concern not only to the province but to the national government as well. Back to you in studio, Blaine.
The Eastern Cape is in sharp focus. We'll come back to you, Busisiwe, in a short while. Thank you very much indeed for your reporting.